Okay, we are going live in 5, 4, 3, 2, 1.
Run down to Craig's and ask him to give me a copy of the agenda. He'll probably have to make me chairman on this meeting. I forgot to bring it. Thanks to God. He's in the meeting too.
Gail, if you can hear me, do you want to go ahead and do a roll call just so we can see who's here and if we have a quorum?
I know Layla's on her way.
Was. Man, just.
Did you hear me, Amy?
I can barely hear you. Yeah.
Okay. I know Layla is on her way. She said you should be here in just a few minutes. I just talked to her.
Okay.
Thank you. Yeah.
Okay.
That's the way to go. Nice to have somebody.
There's Dr. Powell.
And I don't need to.
Hey, Dr. Powell.
Hello.
Copy of what's on the
All right,
agenda.
Amy, that's Dr. Powell.
Okay. So we have our chairman.
Yeah.
Okay. Yes.
I finds out my truck.
Okay,
Yeah.
so we're still waiting. Susan Cash is on there. Dr. Powell, Jake, Judge Craig. And then we're waiting on Laura Roberts.
I'm here.
Okay, good deal.
Hello, Laura.
Hello.
And Carol Benny. Dr. Daly.
Yeah, I'm here.
Okay, Doc, thanks.
All right.
Dr.
Congratulations, Dr. Daly. We appointed you right before you got on.
It's the same, isn't it?
We got Judy Brown. Christy Starnes.
I'm on.
Okay, good.
Hi, Christy.
Hey.
I don't think Heather Brown Connor was going to be able to attend. But Judy, I had talked to her this morning. She was going to try to get on.
I think I count 8 members on, if everything's correct. And then if you said Layla was coming too, that would be 9. So I
Layla's
think
right here.
okay. So we definitely have a quorum then. So,
Yes, we do.
okay. So we can go ahead and Dr. Powell, I'll turn this meeting over to you. Do you have your agenda in front of you or do you need me to help you with anything?
No, I don't have the agenda here, but we'll just go ahead and call the meeting to order. And do you have need to read any minutes or anything?
We have approval of minutes as the first item, and they were sent in the packet. So hopefully everyone received those and had a chance to review them. So we'll just need a motion to approve the minutes or with revisions, if anything.
I'll make the motion to minutes.
I'll
Through a
second.
second?
I'll second Dr. Powell. It's Christy.
Okay, all in favor?
Hi.
Okay.
Okay, the next item then on the agenda is old business. Is there anything that was failed to be followed up on or that you all have pending that needs to be brought back to the group?
Evidently not. So you don't go
I
to the
guess
new
not. I guess the
Oh,
new
it's
business would be next. Does anybody have anything new to bring to the group? We're going to talk about budget and tax rates and all that here in just a minute, but anything other than that that's new? I'm not hearing anything.
That's a good thing.
That is a good thing. I guess everything's status quo. That's rolling it along really well. The next item then is health education report. And I think, Dr. Powell, if it's okay with you, we have Shannon Beatty on from the health department to give that report.
Sure, go right ahead.
Oh, okay, thank you. I just wanted to share a little bit of information for through health promotion and policy and some things that we've been working on. Of course, the Clinton County Health Department or Health Coalition, we use the MAP process, and that's the mobilizing for action through partnerships and planning, and a community-driven strategic planning tool in 2009. And we conducted 4 assessments to identify priority health issues. The top ones that we picked for Clinton County were substance use, obesity, and food insecurity. And of course, through the pandemic, these issues were put on hold, and we were to focus on COVID. So, however, we're now revisiting these top priority health issues and going to be updating the data so our coalition can determine if these are still issues that they want to address or if they want to rework these. And we have done our update with our CHIP plan, so it's on the server. So you can look at those updates on our LCDHD page. And then I just wanted to take a moment to review some of the findings of the data. Some of the things that still stick out as concerns and some things that actually have improved. So with our concerns, we still have a higher rate of adult obesity in Clinton, and it's at 38%. And of course, this data is per county health rankings. And that's compared to 37% for our district and at 35% for the state of Kentucky. So we're just a little bit higher than the district and a little bit higher than the state's average. The next thing that's a concern is our adult smoking rates, and they're at 30% compared to the district at 27.8 and at the state of Kentucky at 24. So that might be something that we really want to target too later on or rework. Next is our food insecurity rates. In Clinton County, they are 17% compared to Kentucky at 15%. So we do have a higher rate than the state average. So that is still an issue in our county. And then of course, finally, we have teen birth rates in Clinton County, and they are 49 as compared to the district at 45 and Kentucky at 31. And of course, those rates were based on population of 100,000. One thing that we have improved on, and this is obesity, which contributes to the raising percentage of diabetes. So we've actually worked on our diabetes issues. In Clinton, we had 12%, and that is lower than the district at 14% and at lower than Kentucky's rate at 13%. So that's a good thing. So even though we do still have high obesity rates, we've lowered our diabetes rates. And so as you can see, we still have a lot of things to continue to work on. And maybe some things that we even with our coalition want to revisit and go a different direction. So that's the information I have. And these rates go from, I think it's 2011 to 2021. So that's how we can see how we've changed. But these rates are actually 2021 rates, last year's data. So, and that's all I have. Does anybody have any questions?
No, you did a very good job.
Thank you, Jake.
I think the next thing is financial statements and audit report.
Yes, sir. And I'm going to ask Ron, our financial department head, to go over those with you guys and give you a brief summary of that. The financial statements are nothing that has to be motioned on or approved. It's just an FYI type of an item. And then the audit, once he presents that, will need to be motioned and approved.
Thank you, Amy. Let me share my screen here. Can everybody see my screen?
Yes.
Yes.
So in prior years, we had normally sent out the financial statements sometime between August and October, depending on if you had an audit or just depending on just how everything got delayed, whether it be with the state or here, whatever. And since sometimes the financials are sent out in October, November, I started thinking it was kind of silly to not just include it with your packet in February, since the meetings are in February, and that way you can get the official statements in hand. And if you have any questions, you can bring them to the meeting, or you can ask me while we're on the meeting. So I'm going to start doing this moving forward every year from now on. So the first thing I am going to present is the financials as of June 30, 2021. That was your most recent fiscal year end for the Clinton County Public Health Taxing District. And like Amy said, I'll do that, and I'll move right into the audit after I'm done. If you have any questions about either, you can ask me. You can stop me at any point. But I'll move quickly through the audit after the financials, because they basically reflect to the everything that I've already said on the financials. So the first thing I want to present is the financial statement for the fiscal year end June 30, 2021. The cash that you had on hand as of July 1st, 2020 was $302,207. You received total receipts during the year of $181,532. That was, of course, made up of nothing any different than you normally receive. The real estate taxes, tangible property taxes, motor vehicle, some delinquent taxes, some other taxes, which represents telecommunications tax, and interest income from your bank accounts. That left you with total cash available before any expenditures were made of $483,739. The total expenditures that were spent through June 30, 2021 were $154,215. That was comprised of a little bit of maintenance and repair, your normal 2.8% district management fee to be part of the district, a little bit of materials, some dues and subscriptions, had building improvements of $4,000, had a small amount of furniture and fixtures that were bought, and then a little bit of equipment purchased during the year, giving you that total. That left you with cash on hand of $329,524. That gave you a balance in your checking of $225,058, with the remainder going to your CD, which is $104,466. To see a little clearer breakdown of that is our balance sheet on the next page, where you can see the difference between the operating account and your CD, giving you that cash total as of June 30, 2021. Moving on, this is probably the statement that you'll be most interested in. This shows you where we fell in relation to budget. And as you can see, in total receipts, we budgeted you quite close. We budgeted you in total receipts of receiving $180,665. You actually received $181,532, so you received a little more than we had budgeted. And here's the individual categories, which you have in your own packet to make that up. If you have any questions, you can ask me about that. And here's the individual breakdown per expense line that we did compared to budget. And as you can see, you spent well under the budget. Mainly, as in most of our districts, that was because we had a pretty quiet year in Clinton County. We didn't have a lot of major building repairs in 2021. We didn't have any really big HVAC units that needed to get repaired and things like that. If that would have came to fruition, that total would have been much closer to break even. But we always budget a little bit of buffer in those costs for maintenance and repair and equipment in case we have those problems of laptops going out and printers needing replacing, things like that, and big building repairs are needed. But y'all had a pretty quiet year in that department. So all the money you retained from saving on those expenses went back into your cash, and that gave you a net profit, or a net surplus of $27,317. And they actually allowed you to be over, but that actually allowed you to be $32,520 better than budget. So that was good. All that can be used toward anything we need for the health department expenditures this year on budget, which I'll get to here in a little while. Moving on really quickly to the audit. I will not spend a lot of time on the audit because, like I said, it is basically a reflection of the financials I just presented. I do want to go through a couple pages or a couple lines on a few of the pages though to show how the auditors gave our report. So if you go over to if you can't see my screen, if you can just look at my screen on your packets, it's page of 11 of 26, and it's under the paragraph on the independent auditor's report called the unmodified opinion on regulatory basis of accounting. The auditor said in their opinion, the financial statements referred to above present fairly in all material respects the assets, liabilities, and fund balances of the Clinton County Public Health Taxing District as of June 30, 2021, and the respective revenues and expenditures for the year then ended. That basically in layman's terms means that we had a clean audit. Our financial statements looked good. They were clean. They didn't find any errors that they thought they needed to present on or anything like that. So from a financial statement perspective, everything was clean. So that's good. We had a good report there. There is another report I'm going to read in just a second that gives our how we were in regards to government auditing standards. I'll give that in just a second. That's once again our balance sheet right there. I'm not going to go through that. There's their report on our financials, which is the exact report I just gave you, just in a little different form. Here, most of these notes are all recurring. I have been referencing that there was a COVID-19 pandemic note that said since early 2020, the COVID-19 pandemic forced certain restrictions in the U.S. and the state of Kentucky. The economic impact of the pandemic could result in a negative impact on the taxing district's revenues, which, as you just saw in your report, so far, COVID has not negatively impacted our revenues, but the auditors have felt they needed to put that in there. The duration and pervasiveness of the pandemic are uncertain as of the date of these financial statements, and the tax district is continually evaluating the impact of COVID-19 on its operations and finances. Just thought I'd add that in there because that's kind of a newer note that the auditors start adding during COVID-19. Of course, that note will more than likely go away, probably starting next year or the year after when they do audits in the future. This is the last thing I wanted to read you from the audit. This is how we complied with our internal control over financial reporting and compliance in regards to government auditing standards. If you go on page 16 of 26 of your packets, under the paragraph that's labeled compliance and other matters, labeled in bold here, it says as part of I'll go with the very last sentence here. The results of our test disclose no instances of non-compliance or other matters that are required to be reported under government auditing standards. So once again, in regards to our internal control over compliance, in regards to government auditing standards, the auditors found no instance of non-compliance. So that means once again, we had a clean audit from a financial statement perspective and from a government auditing standard perspective. So everything is good for Clinton County. So that is a good report.
Great.
Okay. That's all I have on the financials and audit before we move into the budget and tax rate. Does anybody have any questions for me? Okay, I'll take that as good. If it's okay with Dr. Powell, I'll move into the tax rate and budget.
Ron, let's go ahead and get a motion to approve the audit.
Yeah, that's right. Sorry.
If you don't care, before we move on.
Absolutely.
Amy, I'll make a motion. Judge Craig.
Thank you, Judge Craig. Thank you.
Is there a second?
I'll second it, Carol.
All in favor?
Aye.
Can't see raised hands. Okay. Any opposed? Okay, motion passed. All right,
This is
next,
Carol. I can't get my video to work. Sorry.
that's okay.
Can you see Carol, at least
I can
the
see
screen?
you all. I can see you all.
Okay.
Yeah.
Okay, perfect.
All right, so setting the tax rate and approving the budget.
Yes, so the tax rate, we always put that first in the budget to, I guess, kind of a reminder that we're supposed to do the tax rate first on the approval. But we always, if you guys remember, always in prior years, we like to present the budget first so that you can see how the tax rates are giving you your bottom line. And that way it gives you a little more informative decision on how to pick your tax rate. For For the last many years, I think you've ran at a 0.035 tax rate, which is how I'm going to present your budget. You'll see two categories to the right to give you a little different variation of the tax rates. But the 0.035, in my opinion, has served you guys well, as you can solve based on this year. And I'll show you based on your prior years too here in just a second how that served you. But of course, that'll be up to you guys after I present the budget, how you guys want to handle that tax rate. So if you guys can see my screen up here at the top, and I'll try and zoom a little more because I know this is small because we have a lot of information on here. But before we actually get into the main piece of the budget down here, we always want to show you how we arrive at our beginning estimated cash balance as of July 1st, 2022. How we arrived there is we took the balance as of December 31st, 2021, which is when this report was prepared, was the most recent closing month that we had available. And in your checking account, you had $267,913. And in your CD account, you had $104,990 with a total combined cash of $372,903. We had projected that your remaining receipts through June 30, 2022 were going to be tax receipts of $62,336, comprised of the normal taxes we talked about a second ago, the real estate, motor vehicle, the tangible, delinquent, and telecommunications. We project that your remaining interest earned from checking and CD was going to be $1,329, giving you a total remaining receipts through June 30, 2022 of $63,665. And that would give you total funds available between checking and CD of $436,568. We project that the total remaining expenditures that you have for the year are as follows. You have the second half of the district 2.8 cent management fee of $73,336. You already paid the first half back in early December, and that second half will be paid back to us to be part of the district as of end of May, early June. You have some advertising and printing left. Once again, that may or may not be spent, but is there if we need it for $300. You will be paying the audit fee of $1,400. That will be paid out this month or early next month to pay that out. So there will be another $1,400 spent for the audit fee that you guys had. There is remaining maintenance and repair of $10,022. Once again, there is a buffer in there for miscellaneous costs. So anything you don't spend in that, of course, will go back into your budget for the one we're about to present. You have leftover dues and you have some more dues and subscriptions that you have to spend of $715. More than likely, you'll retain this next category of board expense and other miscellaneous for $500. That's the fee we normally had to do the local board meetings every year for the food costs. But of course, this year we're over Zoom, so there wasn't any food costs needed. So if we are in person next year, that's what that'll be used for. We have leftover furniture, or we have remaining expenditures for furniture and fixtures of $6,659 and equipment of $14,700. That if all of that is spent, that would be total remaining expenditures of $107,632, and that would leave you a cash balance as of July 1st, 2022 of $328,937. Once again, between checking and CD. Getting now into your budget, we have projected that you're going to have total budgeted receipts of real estate taxes of $131,444, budgeted tangible property taxes of $28,078, and motor vehicle taxes of $20,783. I know most of you know this, but some of you who either haven't been on a meeting in a little while or are new, and I don't know if anybody on this board is, but just in case, we always want to explain to people where we get these numbers. We are provided from the Office of Property Evaluation every year each county's breakdown of taxes from the prior year, and we use those prior year numbers to estimate the taxes for the upcoming. That's where we got the numbers for Clinton County, and then we put them in our own calculation sheets to separate out the rates and how we want to show you guys the rates. And of course, this one is showing at 0.035. And we take the results of that, which are down here at the bottom, at a 95% collection rate. And the reason we do the 95% collection rate is because we feel like there's always a few percentage points in there of chance of not receiving all the funds. So based on those calculations, that's the numbers that I just presented to you. The delinquent tax collections are always hard to estimate. I always base that on prior year, but since they're very hard to estimate month by month, sometimes we pay in a few $100s, or sometimes it's $1,000. You just never know month to month, so it's a little hard to estimate those. But based on what you've received, trending in the last year, projecting you'll receive $4,438. Your telecommunications tax projected to be $1,183, and your interest income from your checking and CD $2,304, and that would give you total budget receipts for year end June 30, 2023 of $188,230, and that would give you total cash available or funds available between checking and CD of $517,167. Moving on to budget expenditures for the year. The 2.8 cent management fee is the first line we have here of $151,835. Once again, the fee that you guys pay every year to be part of the district. We have our normal building maintenance and repair cost. We have snow removal, which I think I increased this year. It seems like the salt and the labor and all that's going up for snow removal. And if we have another bad snow year, we really need those funds to be able to cover that. For snow removal for our parking lots and sidewalks for $2,000. Landscape maintenance, that's routine for fall and spring, $1,000. That's normally something that goes in your budget. They are asking, and I'm sure Gail can answer any questions you have. The Clinton County office is asking for a 125 BTU gas furnace due to the other one's age and how old it is, and I think they're worried it's either already struggling or about to go out or something. For $11,000. And a total miscellaneous cost for anything else that may come up during the year for big building costs of $15,000. That would give you a total $29,000 building maintenance and repair estimated cost. Furniture and fixtures, we didn't have any specific line items that were requested by Clinton County this year, so we just had the miscellaneous cost to cover anything that could happen: broken chairs, tables, any kind of furniture that's needing replaced for $5,000. And then moving on to equipment, if y'all remember, y'all have a automatic generator that we have now that kicks on anytime the power goes out in the building. Helps protect us from losing our medicines and things like that, and keeping some laptops up and things like that. Allow us to conduct business. The annual maintenance on that, just to top off fluids, and for those specialists to come in and make sure and check that it's running properly. It's one time a year. It normally ranges a little less than 500, but just to make sure that we always budget 500 for that. The miscellaneous computers and related equipment is basically anything that may break or that we may need to get replaced or added on to. That's from a computer perspective. That'd be printers, scanners, faxes, laptops. Anything that's computer or IT related would go in that category for $7,500. Other miscellaneous costs would be like if we had to replace like a medical fridge or some other piece of equipment that is not IT related. We have a $5,000 miscellaneous budget in there, giving us a total equipment budget of $13,000. You do not have to have an audit again till 2025. You guys, because of the total amount of your receipts, are only required to do an audit once every 4 years per SPGE requirements. So there is no audit budgeted for fiscal year in 2023. You have normal advertising and printing costs that we budget for $300. Your normal dues and subscriptions to be part of the CalBO, and we're required to be SPG and KP and then also KPHA for $1,500. And your miscellaneous board meeting costs, once again, that's for food costs if we're able to meet in person next year. And any other costs that don't fit in any of these categories for $500. That would give you total budget expenditures of $201,135, and that would give you a balance of cash, if all those are spent, of $316,032, and that would give you a net deficit of $12,905. Now, I think we all understand that more than likely, there's a good chance that you won't spend every penny of these categories. So more than likely, this is going to be much closer to break even than being a $12,905 deficit. But if everything is spent here, of course, that deficit can come to fruition. But I did want to show you something before you move on to the tax rate, showing you your growth or where y'all have landed at. as you can see, in most years there's been good times where you surplused, but there's been a time or two where you've had a deficit. If you look at Clinton County's total surplus and deficit, which is this third column over here, there's one year or so you had a small deficit. But most time your rate has served you well to help allow for you to, if you're needing a major building purchase, or needing to make upgrades or something, the rate y'all have has served you well to be able to do that. So anyway, I'll now entertain questions for the budget. If there are no questions, y'all can move to discuss the tax rate.
Ron, what about the tax adjustment for motor vehicles? How's that going to affect us?
Are you talking about the projected potential increase?
Yes.
I'll let Amy's heard a little more on that. I'll let Amy speak to that.
It's my understanding, Judge, that was signed into law or went into effect, and then now it's been reversed, and that's going to not take effect. That's not going to be an increase there. So everything we're budgeting is based on last year's numbers, and it should hold for us. I don't expect we'll see an increase there. I know some people have already paid their vehicle registrations and things this year, but it's my understanding they're going to be getting refunds back on that overage, and that it's going to be kind of the same rates for everybody this year.
Okay, great. The refund on it, I think that's going to be wonderful for everyone.
Yes, I agree.
Yeah.
Any more discussion on budget or the tax rate?
What about the tax rates? Yes, I know our inflation has been, it's just been high on our folks. And I said, looks like we're doing great. We're running good. What about, the way I'm looking, is there a chance we could maybe lower this to 3.0?
I think it used to be 3.0, didn't it, Amy?
I'm not sure on that, Jake. It probably may have been. I won't say it didn't used to be.
Yeah, I think
it's your all's.
we increased it.
Yeah, it's definitely your all's call on how to do that. Ron hasn't got the numbers calculated here for a 3.0.
Yeah, Amy, if you give me just a second, I can tell you pretty quickly what that would run.
Okay.
Just hang on just 1 second.
Okay.
The reason that wasn't done is because at the rate you currently have now, you're already budgeted at a deficit. So if you decrease the rate further, it'll be a further deficit this year. But we can calculate that for you and give you all that as an option if that's what you want.
Yeah, hang on just 1 second. That won't take a second.
Okay.
It's worth looking at and seeing. Judge brings up a good point.
I thought it might be a good thing if we look at that to see if there's anything we could do.
Okay, can everybody see my Excel sheet, or are y'all still seeing my other page right now?
We're still seeing the first one, Ron.
All right, so hang on just a second. I'm going to show you this. 1 second. Let me stop my share, and I'm going to reshare the different screen here. Okay, so can everybody see that?
Yes.
Okay, so if you look at the bottom here, the red number right here. So if you switch it to 3 cents, you'd be around a $40,000 deficit, and that's just that of course, you wouldn't factor in normally a furnace, but obviously a furnace can go out any time. But even without the furnace, you'd be running about a $30,000 deficit, and that's with normal recurring expenses. So this just keep that in mind.
Yeah.
Okay.
I hate to decrease it with us already running a deficit.
Yeah.
That was. I just.
And we definitely need. It was something to look at, but at the same time, we definitely need a furnace.
Right.
We can't have Gail down there, can we, Rick?
Absolutely. Hey, I just thought if there was some way we could look at that and see the difference, if we could, we couldn't. So
yeah, and I think Amy said a couple of our boards, since some of those rates, some other boards are talking about real estate taxes and how stuff's up in the air with different things. A couple of different boards were pondering just letting it set for a year and kind of seeing how everything goes. If the legislators are going to think about increasing or whatever they're going to do with different things, to see how much it's set in stone, because it could impact how future budgets go. So once again, that's how some of them went and said, let's just see how it goes for a year and then make an adjustment up or down. But of course, like I said, it's completely up to y'all, but I'm just kind of giving you input on what some of the other ones we're thinking about.
Yeah, we can certainly revisit this next year if that's something you all want to do. We can make it just an annual thing. I mean, just always to look at when the option would be right. But and some counties also are looking at their property taxes potentially going up because of the market, for real estate now is so out of control and kind of crazy. So that there may be more money coming in there than what we've budgeted, but there's really no way to know that. We have to go with what historically has been, to kind of base our numbers on. But we can certainly revisit this next year and look and see if we're in a better place and keep that on our radar.
Okay. Well, with that said, then I'll make a motion. We keep them the same.
I second it.
A second.
Jake state.
All in favor, say aye.
Aye.
Any opposed? Okay, motion carries.
Hey, this is when you'll discuss the budget and if you want to approve the budget as is or not.
Any discussion on the budget? Okay, have a motion to approve the budget.
I make a motion, Jake state.
Okay, is there a second?
I second it. Judy Brown.
All in favor, aye.
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 Any opposed? Okay, motion carries.
I'm certain Gail is very thankful not to have to wear her mittens into work.
Yes, thank you all.
All right, next item is local board members whose terms expire.
Gail, have you reached out to any of these board members that are listed here to see if they'll continue to serve, or where do we stand with that?
Oh, I'm sure they'll all be very anxious to reapply.
I ain't expired yet.
Okay, so we have Dr. Daly, Jake, and Heather Brown Connor, it says, that are going to be expiring that will renew with their permission, if that's okay.
And Judy Brown and Layla Haddix.
Do we have to fill out this form and send it
Oh,
in?
Judy Brown and Layla Haddix. Sorry, I didn't see the second line. You're right, Jake.
Yeah,
Sorry.
yeah.
I didn't go on down.
All right.
Yes, you do need to fill out that form and send it back.
Okay. I've got it. I didn't know.
Okay.
If they're all in favor of it, I'll make a motion for them all. Judge Craig.
Okay, is there a second?
I will
I'll
second.
second it. Go ahead.
All in favor, say aye.
Aye.
Any
That went
opposed?
quick before anybody changed their mind.
Absolutely. Next thing is election of officers.
Okay.
I think
Your
we're
current officers are Dr. Powell, Chair, Vice Chair, let me see, Carol Denny, and Treasurer Jake Staten. If they're all willing to continue, we can just do a nomination of the slate. But we do need to make one change. I think Mr. Crabtree had been serving as your all's non-voting secretary member, just so that he could then do business on behalf of the board and save on some signatures and things, some time to track people down for signatures. So if it's the will of the board and the desire of the board, I'm willing to do that in that place, so that we could have that speed of ease of trying to get things done. That's your.
Sounds good to me.
Is there a motion?
Yeah, I make a motion that we add Amy on there as the voting secretary.
Is there a second?
I'll second it, Dr. Powell.
All right. All in favor, aye.
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 Any opposed? Motion carries. Officers to serve on the district board.
Okay,
I
we
think Doc
currently
Daly wants back on there. I'll let him have it.
No, I don't want it. Pays too much.
Yeah.
Who said we should-
I don't know. Judy Brown makes a good one.
Oh, no, no, no.
What about the board we have now?
I believe we need to leave it like it
I think
is.
they'd be good.
I make a motion that we leave it just like it is.
I'd second that one.
Got a motion.
That was quick.
All in favor, aye.
Ah,
Lose, you lose.
Hey,
Any
I hope
opposed?
it goes that easy for me in 2 years.
Motion carries.
Oh, me.
CD expiring on 3/20/22.
Okay, Ron, do you want to say anything about this? I'm assuming we just need permission from the board for Gail to follow up with the bank on that and renew the CD.
Yes, and Gail might remember who we had last time do this. The board can do one of two things, which normally the board doesn't like taking the time to have to get two guys to go out on their own. So you can either appoint one or two members of the board to go out and actually explore the rates before that date and get back with Gail, or you can appoint, or you can say you give Gail the permission, or you'd actually say the clerk manager, and that way we wouldn't have to worry about putting Gail's name in it, and for that way any clerk manager years and years from now can be in the minutes there. But to say that she's able to explore the rate, she can't obviously sign and she can't approve the rate, but she could get the rates for a couple of your board members to review if you want to do that. So it's really one of two options, but y'all need to do one of those two options before that expires, so y'all can get a better CD rate.
Any thoughts on that?
I don't know. Does Gail want to do it?
I don't care to call and get the rates. Jake was on that last time too with getting the rates, finding the best rate.
Yeah, Gail, the way I've done the way I do it for our bank accounts at the district, it's really simple. As long as the person has permission to do it, it's real simple. I mean, literally, she won't. I don't think she'll have to go down there. She can call, or whoever. If a board member just wants to do it, if a couple board members just say no, we'll take care of it. You just have to call, and normally they'll give you any. You'll normally ask for any special rates. Just ask for any special discounts. And normally most of the boards, and I think you guys were one included a couple of years ago, normally y'all don't want CD over 2 years. Because then you're talking about, the not being able to access that cash for longer than 2 years. It gets kind of hairy if you really need it, and then you got to pay penalties. So normally what's normally asked is any special discounted rates, any CDs that are 2 years and less. And normally the bank can provide that for you. And then, of course, you can take your options to a couple designated board members or to the board itself. But normally it's to a couple different board members and say, what do y'all think of this? And then it's approved right there.
Yeah, the last time, this is Jake State. Now, the last time I done the renewal, I made them guarantee that we would not be penalized if we had to take it out early.
Right now, it'd be good to get short term rather than long term with interest rates supposedly going up, wouldn't it?
Good point.
Yeah, that's a good point. Yeah, might be better off with short term. That's why we've got Gail on board.
What if we just let Gail go ahead, and if she's willing to go ahead and take care of this matter?
Okay, you want it like for just a year, or?
That sounds like a pretty good idea, Dr. Cashhead. I think just go for a 1 year and see.
I agree.
Okay, so Gail, it sounds like any deals 1 year or less that they're fine with. So 1 year or less. So there will need to be, if y'all really want Gail, you need to be in motion to say that I would like the clerk manager to have permission to discuss all of our account CDs with the bank. And then after that, unless I'm wrong about this, but I think there'll need to be a second motion after that to say which board member or board members would need to review it to make the final decision on that after Gail brings it to them.
Do we have such a motion?
I make the motion that Gail check it out.
Okay. And is there a second?
I'll second.
second.
Oh, I'm sorry.
That's all right.
Okay, we got a second. And all in
I'll
favor?
second it.
Okay.
Whoever.
All in favor, say aye.
Aye.
Okay.
Aye.
Opposed? Okay. And then when Gail gets it, she can bring it before at least 2 board members. And so go from there.
Yeah, I make a motion that once she gets that, that she brings it before, I think we need to go in front of Dr. Powell and maybe Judge Craig.
I'll
Any
second.
thought?
I'll second
Okay.
the motion that Jake presented.
All in favor of the motion?
Aye.
Any opposed? All right, motion carries. All right. Next is the director's comment.
Okay, I will be extremely brief. I'll try to get y'all out of here on time today, not be long-winded, but I want to introduce myself to those of you all that I haven't had a chance to meet yet. My name is Amy Tomlinson, and I have been appointed director of the health department last June, about the middle of June, I guess. And then Mr. Crabtree officially retired the end of July. So that allowed for about six weeks or so of overlap in his tenure and mine to kind of learn from him, job shadow, and gather as much information and training as I could from him. So I became solo director on August 1st of last year. And while I'm new to the role of director, I'm not new to the health department. I've been an employee here for over 17 years in various different capacities. I've worked in a lot of different programs and areas and done a lot of different things. So I'm super excited to be able to serve the community and the region in this capacity now as director. And I just want you all to know that I'm always have an open door policy, and you all always are welcome to call me or text me or email me anytime with concerns across the region. I want to give you all just a very brief update on COVID numbers. I know that's still on a lot of people's minds. And while things are looking better and coming down, we are still at numbers that are comparable to where we were with the Delta surge. So if you remember, Delta hit last fall, about the time school started, early in the fall. That was our Delta surge, and we thought that at point in time was going to be something like, the worst thing that we had seen, and it was at that point in time. And then those numbers started to come down, and then around the holidays, of course, you all know Omicron hit right after the first of the year, January timeframe, and that had been an exponential spike like we had not seen ever before. So those numbers are coming down now. The Omicron spike, the surge is winding down, and it's coming down quickly, but it's still about to the point where we were with Delta back in the fall. So it's not as low as we were last summer. If you remember last summer, we almost thought things were kind of on the downward trend and kind of winding up and about to be over. And then Delta and some of these other variants came around. So things are looking better. We're not out of the woods just yet. There's a lot of changes going on as far as at the federal level and the state level, as far as masking and all the recommendations and things. So all of that's still shaking out a little bit. You've probably heard on the news over the weekend that CDC changed their guidelines again late last Friday, I believe it was, about masking. And I expect this week, this week that the state is going to follow suit and kind of mirror the same things that CDC put out last week. So I look for some sort of a color coding chart that looks at things like new cases announced every day, as well as hospitalization rates and different things, different factors that kind of gives a overall picture for the county of the ongoing transmission and different things as far as the recommendations for COVID. We're very much at a point where, we have vaccines available. We know all the things 2 years into this that we need to be doing the right things. And it's very much becoming a personal responsibility kind of a situation to take care of yourself and your family and do the things that we know that we should be doing, and stopping the overall overarching mandates and things on people and just expecting people to do the right things. Now, whether or not that's going to happen, that's I guess just like everything else. Our vaccination rates are not where they would be if I were in charge. If I had my say on things, I would prefer that many more people be vaccinated than currently are. But that's a personal choice, and that's something everybody has to be comfortable with for their own decision making. And we just don't have the numbers across our region, not just in Clinton County, but across our region where they should be. I think we may have 1 or 2 counties out of our 10 that are over 50%, but most of our counties are within the 40-ish percentile range of vaccination. So we still have over half of our people that are not vaccinated. So that's definitely going to be a problem moving forward. It's going to always, those kinds of numbers are going to keep things around and in the circulation for a while. There will be some natural immunity from people who just get the disease naturally and go that route. But it's just not, public perception of COVID has been a challenge from day one. And the more that this drags on and the more federal mandates and state mandates and things that get involved, the uglier it becomes. It becomes a very political thing instead of a public health thing, which is unfortunate. Other than that, the health department continues on as normal. Just because COVID has been going on for 2 years plus now, doesn't mean that everything else has stopped for us. We've continued to do health education. We've continued to do diabetes classes. We're continuing to do WIC and HANDS classes and visits. So all of our programs have pretty much continued on. And while they haven't all been able to be done in person, we're still continuing as much as we can virtually and through any other avenue that we can. So the health department has continued right along. We've just switched hats and kind of changed the method of some of our delivery, but everything is still continuing. And I'm extremely thankful for our local health department staff. They have done an amazing job with everything from the very beginning, from all the mandates and enforcement and things that we were forced to do early on, to the testing challenges that went on with all of our counties, making sure that people had an opportunity to be tested if they needed to be, down to right when we got the vaccines and we had to prioritize groups to get the vaccines and who got it first and administer all those doses and then the boosters. Our health department staff has done a job that I could not ask for more. They have just done above and beyond and done everything with such grace and dignity. And I'm just so thankful for all that they've done. And having said that, I will say that this year, 2022, is going to be our 40th anniversary as a 10-county district. And that's going to actually happen on July 1st. The health department came into existence in 1971 as a 5-county district. And then in 1982, we added the 5 additional counties that made us a 10-county district. And in 1971, we were the first health department district in the state that was recognized. So that puts us as the longest serving continual district health department in the state. And if I'm not mistaken, I believe we serve geographically the largest area in the state. And we're the longest, like I said, the longest serving. So there's a lot to be said in those statements, that these partnerships could exist for this long and be this strong and continue. And everybody put egos aside and all the things, and do the best in the what's in the best interest of our communities for that long. And I'm so proud of all of these partnerships and our communities as a whole. And I look forward to being able to do some sort of a anniversary celebration maybe this summer and invite you all into the health departments to show your appreciation to our staffs themselves, our staff members, and just know that we're here for you and that our communities are our number one priority and that everything we do is based around what we feel is best for our communities. And like I said, I appreciate the opportunity to serve as your all's director, and my door is always open. I'm always willing to answer questions or find information for you if it's needed. You just have to reach out to me. And if you don't have my cell phone number or my email, you can get with Gail there at the local office. She has that information and can share that with you. And I'm more than happy to talk to you all anytime. I'll turn it back to Dr. Powell. And I think the next thing on there is a diabetes report, Dr. Powell.
Yes, it is.
And I don't see anybody on the meeting from our health department staff that can talk about the diabetes. So just let me say, in some of our counties, they haven't been able to join. And so they have provided you all, I think it's the last page in your packet, some numbers about the diabetes program and specifically in Clinton County. So you can see the rates and the information there for your county specifically. But as Shannon said earlier, I think one of the things that she said you all were doing right is that your diabetes rates have actually decreased over the last few years. So that's a good thing. And it shows that you all have worked really hard to get those numbers down. So if you have any questions about the diabetes programs in particular, you can let me know or let Gail know, and we'll get you in touch with someone from the health department that can answer those specifically.
Sounds good. Next item is to adjourn if there is no further business.
Hey, Dr. Powell, Chairman.
Yes, sir.
I'd like to thank our health department. I'd like to thank Amy for everything she has done, for always answering the calls different times of the night. And I want to especially thank our local health department here. These guys do a phenomenal job. And I've been down there a couple of times, and it's just, you know, they just take care of the people that comes in. And I want to congratulate them on a job well done, as well as all the board members.
Thank you, Judge.
Thank you, Judge. Mm-hmm.
Very well said, and I second that. Any more comments?
I just want to say, I was going to mention that earlier there. I didn't want to interrupt Amy, but I feel that we're very fortunate to have Amy, who's been in this system, as she said, 17 years and all. And I think the transition has been smooth. I think Amy's doing a great job. She's available, transparent, and I just feel like we're blessed to have her.
Absolutely.
Thank you, Jake. I appreciate that.
Any other comments? Okay. Thank you.
I make a
Amy.
motion to adjourn.
Got a motion to adjourn. Is there a second?
I
I'll
second it.
second.
I assume no objections, so we are adjourned. Thank you all.
Thanks,
Thank you,
everyone.
everybody. Thanks for attending.
Thank
Okay,
you.
bye-bye.
Bye.